Knee cartilage allows smooth movement and absorbs shock during daily activity. But injury, stress, and degeneration can slowly damage this protective surface. Pain, swelling, and reduced movement are common symptoms. To restore joint function, surgeons use advanced cartilage repair techniques. One method, called microfracture, stimulates new cartilage growth. Other procedures transplant healthy cartilage into damaged areas. Modern regenerative techniques help rebuild the knee surface. Recovery requires patience, rehabilitation, and controlled movement. Over time, the joint becomes smoother and more stable. And for many patients, cartilage repair can restore pain-free mobility.